The World Health Organization has reached out to China for more information regarding an increase in respiratory illnesses and clusters of pneumonia in children. The WHO's China office has described this as a routine check. Chinese authorities from the National Health Commission held a press conference on November 13 to report the rise in respiratory diseases. They attributed the increase to the lifting of COVID-19 restrictions and the circulation of known pathogens such as influenza, Mycoplasma pneumoniae, respiratory syncytial virus, and the virus that causes COVID-19. Both China and the WHO have faced criticism regarding the transparency of reporting on the initial COVID-19 cases in Wuhan in late 2019. On Wednesday, the WHO stated that groups, including the Program for Monitoring Emerging Diseases, reported clusters of undiagnosed pneumonia in children in northern China. It is unclear whether these clusters are related to the overall increase in respiratory infections previously reported by Chinese authorities or if they are separate events. The WHO has requested additional information from China, including epidemiologic and clinical data, as well as laboratory results from the reported outbreaks among children. They have also asked for more information about the circulation of known pathogens and the impact on healthcare systems. The WHO is in contact with clinicians and scientists in China through its existing partnerships and networks. The WHO China office has stated that it is routine to request information on increases in respiratory illnesses and clusters of pneumonia in children from member states like China. The global agency decided to issue a statement on China to share available information due to media inquiries. Undiagnosed pneumonia was not mentioned in the press conference last week. But one speaker did note an increase in respiratory illnesses compared to 3 years ago. The speaker explained that global monitoring for Mycoplasma pneumoniae had been low in the past 3 years, and epidemics tend to occur every 3 to 7 years. Since mid-October, northern China has reported a rise in influenza-like illness compared to the same period in previous years. China has systems in place to capture information on illness trends and report the data to platforms like the Global Influenza Surveillance and Response System. In recent days, videos from cities like Xi'an in the northwest have shown crowded hospitals with parents and children awaiting checks. Some social media users have shared photos of children receiving intravenous drips while doing homework in hospitals. While seeking additional information, the WHO recommends that people in China follow measures to reduce the risk of respiratory illness. These measures include vaccination, maintaining distance from sick individuals, staying home when ill, getting tested and seeking medical care as needed, wearing masks when appropriate, ensuring good ventilation, and practicing regular hand washing.